All right. Well, good afternoon, everyone, and thanks for joining us. I know this is a really busy day for folks. It's Friday. It's Good Friday. It's Passover. It's my second shot day. So thank you all for joining us. We look forward to a very good conversation with moderated by our very own Dr. Laura Lee Hall. She, as you all know, she's been leading the way in quality improvement in the vaccine and immunization space. So she has two folks that are with us. One is our very own Kellyanne Collins. She helps with our communications and outreach here at the National Minority Quality Forum. And she has been indispensable working for us since she joined us about a year ago. I don't think we would be where we are right now without all her insight and work and just kind of getting things done. I think Kellyanne's biggest issue is that she never tells us no, and she didn't say no today. So we're glad that she's ready to impart her knowledge to the folks. And then we have future Dr. Lash Nolen. She is about to earn those very important two letters behind her name. She is or was, I'm not sure, Dr. Nolen, a future Dr. Nolen. She was the student body president at Harvard's Medical School, and she's been working with our team. So we would like to I'm actually just going to turn it over. They're far smarter and more educated people than me on this call, so I'm just going to turn it over to them, and I'm going to let the PhD go for it, and that's Dr. Laura Lee Hall. Dr. Hall?
Well, I thank you. You are plenty darn smart, Brandon, and a great advocate. So I hope no one is under any illusions otherwise. Let me just get my screen set up here. Is it good to go? Everybody can hear me? Everybody can see this? Without any nays, I will proceed. Become a community COVID-19 champion. So I am eager for all of you to join us in our endeavor. So let me tell you a little bit about it before turning it over to our amazing guests. Okay, so let me actually introduce our guest, and they deserve a while because of all they've accomplished in their young professional lives. Lash Nolen, who is a medical doctor in training in the class of 23 at Harvard, graduated from Loyola Marymount University in 2017 and served as the student body president there, spearheaded voter registration initiatives, and also created a diabetes prevention program for women at a domestic violence shelter. This is all like during college. She spent a year in the AmeriCorps in Chicago, actually working with patients via health education and motivational interviewing. As I've noted, she's a Harvard Medical School student candidate and class president of 23. She's also found time to found the project, We Got Us Project, a collective Black community members in the Boston area dedicated to educating their communities about health inequities and disparities in the COVID era. And of course, she's a 2020 NMQF 40 under 40 awardee. And perhaps importantly for today, she's one of our biggest, I don't know the right word for this, given the generation I come from, but most impact with a social media promotion about her award of 40 under 40. So she is a true maven with social media. Kellyanne Collins, she is part of our team. She joined as the founder and CEO of Vult Lab. She's become our arm in communications and has been amazing to work with. I mean, you can see here, her resume is equally outstanding in terms of having executed so many projects for so many important nonprofits and brands, UN, Bill and Melinda Gates Foundation, World Bank, USAID, Starbucks, the Duke and Duchess of Cambridge, etc. She helped launch USA Today's website. She's probably ghostwritten for almost anybody you know who has spoken out about health. And she was picked in 2020 by the UN's World Food Program as an ambassador for good. So we are really lucky to have them today talk about what they have done to communicate and promote health equity, and what we are looking to do in partnership with all of you partners and participants in this webinar. I have another wow. This is our team at SHC. Kristen Hobbs and Naomi Eladibi, two wonderful people who help us implement the programs that we have been working on. Okay, still another wow. We put together an advisory group for the project that we're going to begin a conversation about today. And all of these individuals have committed themselves and done so much already to promote health and health equity. So before we get into some how-tos and what we're doing, I just wanted to briefly, not go into too much detail on data, think about aloud with you where we are now in vis-a-vis COVID. So this was updated at midnight or near midnight last night. I think that you see the 6.5% growth rate. Here's another way of showing that data. This was updated this morning. And you see the new cases are rising 20% in the 14-day change, although thankfully deaths have declined, the rate, and hospitalizations. So just trying to give us a sense of where we're at. So you see the number of cases spread out on a map, because no national statistic is going to completely guide us in thinking about how we will move forward. So the darker the red, the more reported cases per share of population. I guess that's all to conclude. It ain't over. Now this is let me move my bar here so I can read the title. I don't know if you can see above it or not. This is one way of portraying various populations' access to COVID vaccination as compared to their representation in the population and among COVID-19 cases and deaths. And Alabama is the first line here. This is Black population. This is as of, let's see, 5 days ago. So you see here that I'm going to pick on Alabama because it's first in the group here, that Black people in Alabama have received 21% of the vaccinations, despite representing 29% of the cases and deaths and 27% of the population. I'm really, shocked about this one here, the District of Columbia, where the Black population, Black people received 36% of the vaccines, despite so many of the cases and deaths and population. So these are just one way to kind of look at the disparities. And we have all the cases here. They have, this is in the New York Times today, and it's based on data from state and local health departments and census data. But they also have this for the Hispanic people, the Hispanic population. And so you see in California, 22% of the vaccinations have gone to Hispanic people, despite them representing 55% of the cases, 47% of the deaths, and 40% of the total population. So I think we see there's some gaps. Other research that came out recently suggests a few things, some of which seem like, yeah, we knew that, and some maybe a little surprising. I think that the recent poll or survey that the National Urban League sponsored suggests that among the Hispanic population, there's really a lot of people have not heard a lot about the vaccine. I put this slide up because we've seen a lot of discussion about the disparities in vaccination among people of color that kind of implicates the population as being lacking in vaccine confidence. But data like these suggest that that's really not the main issue. There are, of course, vaccine confidence issues in different populations, including people of color, but most Black and Hispanic people actually intend to vaccinate. It's not them, it's the system we live in. I wanted to remind us that healthcare workers who have so closely witnessed the impact of COVID-19, many of them are not taking the COVID-19 vaccine as you would expect. And there are racial disparities, as you can see here, among them. I was interested in the information that was in the newspaper over the last couple of weeks about the military, where there's been not a great level of acceptance of the vaccine. And that's especially true among the enlisted service members. As you see here, I've bolded. So those are also the younger people in the military. And what was reported both in CNN and in the New York Times is that what seems to be working best in helping members of the military accept the vaccine is really testimonial from their peers and their leaders right near them. I'm building an argument that you who are on this call can make a huge difference in your community among your peers. Another article that really caught my attention recently comes from my hometown of Annapolis, where 70% of the residents who contracted COVID-19 are Hispanic, yet very few of the doses of the vaccine, this is mid-March, or the first week of March, only 260 of the 12,000 doses of the vaccine have gone to the Hispanic population. So there was an organization, Take Care, that really canvassed the neighborhoods and did an expansive community survey, something you may be interested in doing and that we can help you with. And what they found in the 300 plus residents who self-identified as Hispanic people, 70% said they were not aware of resources concerning the COVID vaccine. And almost 90% said they wanted to receive such information. They also reported little or no information in Spanish, and that the information they got was outdated. And there was a sizable group who had no access to masks and equipment. So this community survey shaped the outreach that Take Care did. So they combined distribution of 4,200 masks along with information about COVID-19. And they've been staying in contact. Another thing I wanted to just emphasize here, because their hope is this isn't just the only thing they're going to do for the health of the community they care about, but that this will lead to ongoing health equity work with other vaccines, with diabetes and cardiovascular disease management, cancer screenings, that really it's not one and done. So with that kind of setup, let me tell you a little about our project and then I'll turn it over. So we have received a cooperative agreement from the CDC. This is the title of it: COVID-19 and Influenza Vaccination, Communications and Education and Training to Promote Equity in Black and Hispanic Communities. It's kind of what our focus is: recruiting, training, supporting, and promoting champions in helping their communities promote sustainable health, beginning with COVID-19 vaccination. Focused on the Black and Hispanic community. And champions can come from individuals from churches, community organizations, clinical practices, students, patient advocates, etc. I think almost anyone can have a positive impact in their community. We did have our launch advisory group meeting, which I showed you the makeup of earlier. And so here's some of the conclusions from that, or discussion points. It's important to focus on young adults, many of whom have different attitudes about and certainly have had different levels of access to the vaccine. And it's also very important to focus on, people with various chronic diseases like diabetes, sickle cell disease, smoking, obesity, lung disease, cancer, other immunocompromised persons, given the tremendous risk and association of COVID with these diseases. We had a discussion about what are the messages, balancing risks of vaccines versus COVID vaccine, of the vaccine versus COVID, asking people what their plan B is if they're not going to get a COVID vaccine. Interesting responses to that question, by the way. Remind people that there are many of those who have had COVID-19 have had long-term suffering, and also the importance of ongoing communication. For people who remain somewhat concerned or reluctant or anxious or fearful about the vaccine, it's not necessarily going to be one communication that's going to build trust and help that individual think about what would be best for them and their community. Community is the key. As wonderful as NMQF is, I believe that we will be at our best if we can empower, support, energize, celebrate you in your community. And it could be not just a local community, but your social network. Every day there's like 25 new publications on COVID-19 and the vaccine. So it's fast evolving, and things are changing on the ground rapidly as well. And as I already noted, that we don't believe it's just that we should just be thinking about COVID-19 vaccination, that we really need a sustained engagement and attention to health issues more broadly. That's going to build trust. And I think that's what's going to let communities own their own health promotion. So community health equity champion, what's going to happen? Communications training and resources will be available. And you're going to hear next about awesome communication activities and how those resources can look. There can be support for doing, local town halls, community assessments, educational activities, etc. We would love your help in recruiting additional champions at the community level. And we want to acknowledge you, help put you in a position to interact with your peers as a leader and nationwide. So after we have some other conversations, I will look for you to kind of in the chat box or the Q&A box or during the Q&A, think about what you would need to be a community champion, what populations and informational areas you would recommend our focus on, and how you would recommend recruitment. But at this point, I want to stop sharing and stop sharing and turn it over to our next participant. Let me stop sharing there. I would request that you put your questions in the Q&A box as well. And Lash, Dr. Nolen?
Yes.
Please take it away.
All right, awesome. Thank you so much for that, Dr. Hall. I learned a lot, and I'm very thankful to be here with you all today. And I'm going to be talking to you all about We Got Us, and telling a little bit about the journey to creating We Got Us, and discussing a bit about how we can work together and how you all can feel empowered to continue to do this work in your communities as well. So We Got Us is a community empowerment project that was founded by myself 3 months ago in December. And I was sitting home, the vaccines had just gotten FDA approved, and I was having a lot of conversations with family members and friends about this vaccine. And I realized that in my privilege of being both a Black woman in America and also being a medical student at Harvard Medical School, there was a lot of opportunity to really be an advocate for my family and my community, but that's not a privilege that a lot of people have in my community. So that's why We Got Us was created. And we are graciously funded by the Board of Internal Medicine, the Treffler Foundation, and Life Science Care. So just wanted to shout out our sponsors for making this work possible. So first, I want to talk about exactly why we exist. I spoke a little bit about my personal story and wanted to create this organization, but this is why We Got Us needed to be created. And it's because as the vaccines were rolling out, there were a lot of conversations about quote unquote hesitancy in the Black community. And when they were having these conversations, the focus was really on Tuskegee. It was all about these historical instances of the ways that the medical institution and our government has really harmed our communities. But there wasn't really a conversation about how our communities experience racism every single day. And in addition to that, there wasn't a conversation about access. So what we saw is a lot of organizations using photos of Black folks getting the vaccine and putting them on television as a way to try and say, hey, you know, they're getting it, so you should too. But there really wasn't a space being created to have intentional conversations about the vaccine and getting folks questions answered and listening to their concerns. So it was a very much so like a one-way street when we were talking about the vaccine in Black communities. And then in addition to that, there was this challenge of access. More and more as the vaccine rollout continued, we were seeing that all of the vaccine sites were often being placed in communities that weren't disproportionately impacted by COVID-19. So they weren't being put in our Latinx communities, our Black communities, and those of Indigenous peoples, but they were being placed in predominantly white counties, and there were multiple of the vaccine sites being put there. So there was this issue of who had access to the vaccine. And then we saw that in Boston, where I'm currently studying at Harvard Medical School. And that's when I said, okay, we need to make sure that in the work that we're doing, that we're not only addressing the challenge of getting information about the vaccine, but how do we make sure that people have access? Because some of the challenges that people face beyond this idea of hesitancy, right, is okay, who has access to internet? Who has access to information in their language that they speak natively? Who has the time to sit and try to figure out how to get the vaccine, who has the time to sit on the computer. Some folks were saying it was taking up to 5 hours to get an appointment. And those are all things that people don't always have access to. And it's a privilege to have that. Then we have to think about sick leave, right? So when folks go and get the vaccine, I know that Brandon was saying that he just got his second dose. I know after I got my second dose, I felt terrible, honestly, right? So I had the chills, I had the fevers, but I took my Tylenol and Gatorade and I was fine. But me being a medical student, I had the privilege to, you know, say, I think I'm gonna stay home because I know that I have that privilege and I wasn't feeling right. But if you think about your essential workers and you think about individuals who don't have that privilege, that's something that we have to think about when folks are thinking whether they wanna get this vaccine or not. And then there's transportation that we have to think about, and then essential worker status, thinking about what time the vaccine is actually available to our community members, right? So if you're working from 8 to 5 and the vaccines are being administered between 8 and 5, it doesn't really make it as accessible to you. So these are all the different challenges that we have to think about, and it's something that We Got Us has been constantly thinking about as well. So the reason why this is important is because the We Got Us mission kind of combines these two subjects, which is education and access, and that really informs our mission. So now I'm going to tell you a little bit more about who we are as an institution. And We Got Us is a collective of Black community members, students, and health professionals who are really committed to bringing education and access to our communities about the vaccine. As I said earlier, it was founded by me, but I'm really passionate about working with these amazing students who are on my team, who are all pre-health students, and they're dedicating so many hours to making this project work. And up to date, we have about 100 plus students who are part of our collective. And these are all students of color across the Massachusetts area who are really dedicated to bringing our mission to light. But this is our executive team. We have leaders who are our project directors, our research team, community engagement team, social media, education curriculum. And we also have someone who's leading our youth team, where she is leading a team of 8 youth activists who are high school students who are working on trying to do the same exact project, but really focusing on the younger population and empowering them. So these are some of our community partners. We have over 20 community partners across Massachusetts and also nationally who've really supported our work, whether that be doing events with us or supporting us in really making sure that we're doing the work that the community needs. And it's been really phenomenal to get to work with these amazing people. So this is kind of like the big picture view of We Got Us. And I really just want to use this to share our three main pillars. The first one is empowerment through education. So we want to bring reliable, scientifically accurate information about the vaccine to our communities, because there is this access to education barrier that we have to address. And the second is that we convey, not convince. So we're not trying to convince anyone to get the vaccine. We just want to convey the appropriate, accurate information that our community needs so that when it comes time to make their decision, that they have all the tools in their toolkit to make the best decision for themselves and their community. And then the third is public health first. Up to this time, there hasn't been any data that has shown definitively that the vaccine prevents transmission. So it's important that we continue to do all of the things that protected us up to this point from getting COVID-19. So that's why we're in the community giving public health information, PPE, and sanitizing material. And I think that that'll be really important in any work that y'all decide to do in the future, is making sure that there's a way to empower folks through public health, because we at We Got Us believe that public health must come first if the goal is to end this pandemic. So then this is a little bit more specifics about what exactly we do. And I'll be talking about three main aspects today. And that's our empowerment session, which are these informational sessions where people come together, ask questions about the vaccine. We give information about the trials and the very nitty gritty specifics in a way that folks can really understand and feel a connection to, because we want to make sure that everyone is on the same playing field. So we're going to tell you about the efficacy and the differences and all of those things. And that's available on a national scale. So I just did an empowerment session for my family. I'm originally from Los Angeles, so I did one for my aunt's church in LA. And we're doing a lot of them for organizations in Atlanta, wherever. So if y'all are interested in an empowerment session, please hit us up. And then we're also working on doing all of these other things here, but I want to just focus on three of those things that are shown here. So the first piece, once again, going back to our mission and what we're doing, the first part is education. And these are some of the empowerment sessions that we've done. So we've done them for different schools. So basically we might have like a principal reach out to us and say, hey, look, I was speaking to some of the parents and they're really feeling like they're uneasy about the vaccine. So we'd love for y'all to come in and speak to us. So this is something that we do. And then we also have another empowerment session that happened just yesterday. And it was all about, once again, empowering our communities through information about the vaccine, answering questions. And I think something that I really love about our empowerment sessions is we have a specific portion that's dedicated to medical racism. We're talking about medical racism. We're talking about the disparities that we've seen during this pandemic. So we're not kind of hiding anything. We're like, look, the medical institution and the government has not given us any reason to trust them, but this is why this vaccine is effective. And this is how it can protect us. And if you feel like this information, after you get this information that you think this vaccine is going to be best for you, then go ahead. But if not, you have the space to make that decision because you are someone who is educated and you deserve that respect and you deserve that autonomy. And then we're also creating educational material. So this is one of our pamphlets. This is the pamphlet that we use when we're out in the community. And we're basically using this as a model for creating the same pamphlet in different languages. So there's a lot of Portuguese speaking folk, a lot of Haitian Creole speaking folk and Spanish speaking folk out in the Boston, Cambridge area. So that's what we're working on right now to make this as accessible as possible to our community members. And then on our website, we have a host of different resources that I think would be super helpful for you all. We have them separated by web resources, social media accounts that we think that you should follow on various sites that will be helpful. And then we also have program and events that are happening in our community, right? So as We Got Us, we're not trying to come in and say, look, we got all the answers. You need to only come to our empowerment sessions and events, but we want to amplify all the phenomenal work that's happening in our community. So that's what we really hope to do with our resources page. And if you kind of key in more into the website resources on our page, you can see that we have vaccine site locations and eligibility. community. We have COVID health disparities data, and also Massachusetts specific resources, because of course, that's what we're based out of. So we really have a little bit of everything on there. I really encourage you all to check it out, because as we continue to do this work, I think that it could really serve as a great resource for you all. And then we're also doing research. We're trying to make sure that our empowerment sessions are effective, right? We don't want to do anything that's really not hitting in the way that the community needs. And we're also working on a project right now where we're doing focus groups with healthcare workers who've been identified as folks who don't have as much confidence in the vaccine or have some questions about the vaccine, and really trying to get to the bottom of how we can support those individuals, especially when it comes to access. So speaking of access, these are the ways that we're out in the community. We partner with an organization called Get Out the Vaccine. And what we're doing with them, it was founded by Dr. Alistair Martin, who's a physician at MGH. We're actually helping staff the different clinics that they do at the housing authorities around Boston. So we're out there knocking on doors, helping folks get vaccinated, and talking to them about the vaccine, escorting them downstairs so they can get the shot in their arm. We're also doing in-person canvassing events. This is us in Roxbury just last week, and we're working with folks like Housing Equals Health and other community organizers to really make sure that we're out in the community and knocking on doors, doing canvassing to figure out, okay, like what's on your mind, where are you at? And I will say that last time we were out, it was interesting to see that about maybe 60% of the folks that we spoke to, they were actually already vaccinated or trying to get the vaccine. So I think that this conversation about access is really important, and I'm so glad that we're finally having that. We're also in the process of building out something called a community collective directory, which is basically going to be a speakers bureau for different health professionals in the area who are willing to speak to their community members about the vaccine. And this is really important when it comes to access, right? Because there are only 2 to 3% of physicians who are Black women in America. And we think about how racial ethnic concordance between physicians and patients, that has a really big impact on the way that information is delivered and the way that it's accepted. So we want to make sure that communities who are looking for someone to come and speak on their panel, or communities who are looking for someone to speak to their community organization, that they can find someone who really identifies with them in whatever way that they're looking for. And not everyone always has access to that. So this speakers bureau or community collective directory is a way for community members to come, find someone to speak to their organization, or if they're a health professional, find a way to volunteer their time in a meaningful way. And then we also connect with all of our folks via newsletter. So please feel free to join that if y'all are interested in the work that we're doing. It comes out every month, and we send it out to all of our community groups who are part of our organization, and also folks who sign up via our website. And this is a really exciting in-person event that we're going to have coming up on April 10th. We're going to be doing this in Brockton, which is a community that's just outside the Boston area. And this logo was actually created by one of our community partners, who's a graffiti artist. And at this event, we're going to be out there collaborating with the YMCA and the city. And there's going to be like a lot of family friendly activities like painting and creating plaster molds. And it's really going to be this combination of both the education and the access piece, but then also like bringing us together in community. Like, y'all, we are almost out of this thing, but we got to keep that momentum, and so that we can continue to have celebratory events where we get to come to community like this. So with that, I want to just talk about how we can do this work together, and how you can bring We Got Us to your community, or do something like We Got Us in your community. And I think the first piece is community is everything, right? So everything that we've done, we've had community members informing our work every step of the way, and they've been consistently doing that. And I think as long as we can make sure that the community voice is leading the work, we're going to be okay. The second is to convey, not convince, right? That was our second pillar. And I think that that's so key, because we can't go into community saying like with an agenda, like I want to convince you to get the vaccine, but rather like, let me make sure that the reason why you decide not to get the vaccine is because that was a personal decision that you made after you had all the information that you deserve to have to make that best decision for yourself. And then the other piece is public health first. So I think that if we can get more folks with masks on, and understanding that even after you're vaccinated, you still got to continue to do everything to help protect us throughout this pandemic, I think that will be extremely powerful. And that's something we have to continue to do. And then please, once you decide to do this work, please share We Got Us's material. We'd love to support your work, whether that's through printing our pamphlets, which are available free on our website, or if you're trying to find access to more of our resources, please send them our way. Building out our community collective directory, like this is a resource that you can also use. If you have any practitioners or health professionals in your community who are looking to serve in this kind of a way, that's something that you can definitely do through our community collective directory as well. So with that, I just want to say thank you. This is our contact information. You can just find us at We Got Us Project. We're on Twitter, Instagram, and Facebook. We're also on TikTok, and that's being led by our youth group. So for any folks on TikTok, you can definitely follow us there. And this is our website and our email. So if you're interested in collaborating, having more conversations, our community, our directors can get to you and give you more information. So I'm looking forward to hearing your thoughts and answering any questions. And I want to thank you all again for having me today.
Sorry, I was on mute there. Oh, how amazing. Now it's even more wow. So let's hear from Kellyanne at this point about her work in the communication space and what that might look like in this current project. Kellyanne?
Okay, just going to share my screen. All right, can everyone see that okay?
Yep.
Okay, good. Okay, so I'm here today to give you some information on how you can become a COVID-19 vaccine champion. But before we get started, we have a poll question, and we're wondering, do you use social media? And while you're answering this little pop-up poll, I'm going to give you some background on our end of this initiative. So we're working alongside National Minority Quality Forum's Center for Sustainable Healthcare Quality and Equity to help community leaders and people who would like to be community leaders to educate their communities through an integrated marketing communications approach. And I'm also answering the poll. I use it often. I'm on social media and I use it often. And then we have a second poll question too. So if you do use social media, what platforms are you using? You know, what's your favorite platform? Is it Instagram, Twitter, Facebook, Snap, Twitch, TikTok, LinkedIn? I think everyone has a favorite. I think I love all of them. And while you're answering, I will go ahead and show you how we use several of these channels to educate communities on flu vaccination this past flu season. So in 2020 and early 2021, we worked to help spread the word that flu vaccination is incredibly important, especially during the COVID-19 pandemic. Did you know that you can catch the flu and COVID at the same time? Lots of people didn't know that, and that's definitely something you don't, want to happen. So as a result of our Don't Wait, Vaccinate campaign, millions of people were exposed to the fact that flu vaccination is incredibly important, especially now, during the COVID pandemic. Oh, and as a part of that, we even got some engagement in that campaign from AOC. Okay. And then for the next poll question, I'm not sure if we have the results from the other one yet. Oh, there it is. Okay. Yeah, so most people are on Facebook who are here. 86% of people are on Facebook. And then Twitter, Twitter, Instagram's coming in second. Twitter third at 55%. And then we have LinkedIn at 52%. Then TikTok. For our third question that we have, this is a about the myths. So what myths have you heard about the vaccine? And we are going to collect this information because this will help us create materials for this initiative, because we want to help debunk the myths and put information in people's hands. So who can become a community COVID-19 vaccine champion? Can you become one? Yes, anyone can. Even if you're not on social media platforms, even if you don't use it actively, the answer is yes. So even if you haven't used social media before, we can show you how. As a part of this initiative, we want to teach you how to use social media, how to grow your audience. And then, the hope is that even after the pandemic, you'll be able to help your community. And as a part of this initiative, we're going to be doing media training, communications toolkits, public relations, and events. So from live events and social media and PR trainings, we will be giving you information and tools that you need to help educate your community. So we'll be teaching you, how you can host a live event in your community, or, how you can pitch local media to get the word out about what's happening in your community with COVID. And we'll also be supplying you with toolkits and helping you, learn how to post that information on social media. Okay, so let's see the results of the last poll. I'm interested to see. Thank you. Wow, okay. Some of the myths or things people are hearing in their communities. The vaccine was created too quickly and therefore not safe or trustworthy. That's the top response. The next response is that you don't need to wear a mask after being vaccinated. Everyone will eventually have some variant of COVID-19, so you don't need to get vaccinated. And you can be infected with COVID from the vaccine. Very interesting. So we want to help debunk those myths by putting information out there, and we are looking for people to help, and we want to train you to use the tools so that you can help educate your community. The next question we have is, so that we can make sure that we're helping you as much as possible, is what do you think would help you the most when it comes to educating your community on COVID? Would it be social media materials, graphics, videos? Would it be materials that can be printed that you could hand out in your community, or leave at different locations, business locations or clinics? Or would it be learning the basics of social media, when to post, how to schedule posts, how to engage with your audience, and even, analyzing that to see, is this working? What's working, what's not? Oh, someone else says something that didn't come up, is that the biggest, one of the biggest myths that they've heard is that the vaccine will lead to infertility. I've actually heard that one too, yeah. Or would it help, to share stories from, from community leaders? Would live events help? You could type anything else that's not in the poll into the chat. So every training session that we do will help you become a better online communicator. We'll teach you when to post, how to post, what to post. And we want to work with you and help you do things like host a live event. And like I was saying earlier, pitch stories to local media, help with op-eds, anything really that you would need help with. That's what we're here to do. And we would love it if you would join us in this effort. Okay, what were the last results of the last poll? Oh, okay. Social media kit is tied with sharing stories of trusted local community leaders' experiences with COVID-19 and the vaccine. It's very interesting. Thank you. Yes, we did set up a mailing list, or you can send an email to us. Either way we'll get you, but this is the mailing list. You can sign up here as well. Thank you.
Kellyanne. Kellyanne, that was really lovely. Thank you.
Thank you.
And so maybe you could put the sign up link in the chat too, Kellyanne.
Okay.
So I guess that now we have about 15 minutes to have a discussion with you all and answer questions. So I'm actually going to just go to the Q&A for the first question and kind of throw it out to the panel. How can we reach the brothers and sisters who feel they are not part of the outreach on vaccines and health in general? Those who are not college students or graduates feel they are not addressed. I speak to some men who are re-entering society from incarceration, and they state the same issues, that they're forgotten. Does the panel have any recommendations, examples of how to reach this population? Really, I'd love to hear you all answer, and I'm going to think about this too and maybe have something to say.
Yeah, I mean, I can start off and just say that I think that this is a very important question, and I think it's a question that isn't often answered by folks who, I think that sometimes people think that like Black people are a monolith, right? So they're just like, oh yeah, so every Black person must be in the churches, or every Black person must be a college student. But we're not thinking, and I think that's how we miss the fact that there are healthcare workers who are Black and who have questions about the vaccine. Or as you're saying, like there are people who are incarcerated who aren't getting any information about the vaccine. And a lot of the conversation about making sure they have access to the vaccine just hasn't been happening. And I think that the way that we can address that is that when we're thinking about who needs to be a part of our team and who needs to be included in conversations, that we have representation or someone who can make sure that that group has access to the conversations that we're having are included in the things that we're working on. So I think for us, like you just brought up an excellent point, and I think this is something that we're going to bring up in our next We Got Us team meeting, is how do we engage those folks who are incarcerated in our community and thinking about trying to get an empowerment session to them, or thinking about, you know, what are some policies that we can start drafting or supporting to make sure that they have access to those things. And I think that the first step is having the conversation and then ensuring that those groups are included in everything that we're doing. And I think that we got to get out of this mindset of like Black folks being a monolith, because I think that just leads to folks being left on the margins and not being included in really important conversations. So thank you for that.
I think that was a good answer, Lash. I think I have a couple of thoughts about this question. First of all, I think it's why we really believe it has to be a community level activity, so that the populations that are in need of education and support can be identified and reached out to at that level. I think we need to have champions come from those communities as well, that their peer-to-peer kind of voice could be really powerful. And so I'm hoping that folks on this call and future activities can help us reach out to those populations. I agree that the younger, so it's part of why our advisory group said younger populations, and not just, you know, college students or graduate students or other professional students, but really, you know, a lot of them are working in the community. They probably aren't going to church, or they're not going to their grandmother's church. They may be going to the barber shop, and so there may be some opportunity there. I think community assessment is going to be important to know who has the ear of various populations. So just a few more thoughts about that. And I welcome Kellyanne, if you have any ideas, or really if anyone online has any thoughts about this as well.
Yeah, I know it would be hard to reach people in prisons probably through social media. So I'm thinking maybe that would be where printed materials would come in. But yeah, I love the idea of having a vaccine champion, who is actually, coming from, that, I mean, maybe someone in the prison who's been vaccinated who can tell their story.
Mm-hmm.
Yeah.
That's a good idea.
Sharing that story, brochures, print materials, it seems like would be easier to distribute.
We have a couple other questions that I want to put forward. So this is a comment, but I think it might warrant some conversation. We can post educational information and help people understand the facts that our community's vaccination systems are confusing and uncoordinated. I'm concerned that I won't be able to accurately direct people to true vaccination sites without long lines or being turned away. Isn't that the truth? I do think that, knowledge at the community level is going to be crucial. I know that in our community, there has been a group that has volunteered to help older people, for example, or people without internet access or strong internet access or ability or time to actually do the work of trying to get registered for a vaccination appointment. So that has been one solution that has been creative and I think been working very well here. Lash, I'm sure you have some ideas about this too.
Yeah, I think it's really disappointing and challenging when you say, okay, like here's all the information, the vaccine is great, and like that person then gets to that yes, like I think that this is going to be helpful and protective for me, but then you kind of dismiss them into this system that is very like convoluted and confusing and may not be accessible to them for many reasons. So I think that like one thing that's been really helpful for us is that when we're out canvassing in the community, we also have iPads and we're just basically helping folks get registered. So it's kind of like we try to have a menu of options for folks whenever they get to that yes. So like one challenge is like, okay, how do I get registered? So then we're going to help you get registered. And then the second is, okay, well, I don't have any transportation. So then we're giving like Uber and Lyft discount codes, and we're giving cab vouchers for some folks. And then the other one is like, okay, if that's a challenge, what else might be on your mind? And we're trying to like just connect them with other community resources that can support them. Like there's an ambulance service in Boston that is going into folks' homes and vaccinating them if they're unable to leave their homes on their own, for example. So making sure that they're connected with that group. Or there may be some folks who are just like, hey, like I've been trying to get an appointment for a set amount of time, but it hasn't been working out for me. Like making sure that they know that they can reach back out to us if they have a concern. So like making sure that there's like some level of follow-up, I think is really important too.
And that was kind of in that in the effort in Annapolis, I think, they really kept the loop, they closed the loop. So there's you don't just get kind of dumped off. They also were in communication with the healthcare system policy leaders, providers. So it's almost like an advocacy element to making sure that you're in the loop and knowing what where you can get the vaccine and what resources exist, but also that you can provide guidance to decisions that they make, I think is going to be important. I would also say that we plan on having regular kind of conversations with champions. And I think that everyone who gets involved is going to have something to offer others in terms of understanding the resources available and how they approached an issue. I think we can be each other's best teachers. There is one question I want to make sure everyone is clear about, and I'm sorry I didn't say it, that these services, this program is free to everyone who wants to be a champion. So I really hope that we can engage all of you. I see another comment that is for my community it would be material in Spanish and appropriate health literacy reading level. So another conclusion from our advisory group and environmental scan so far is the relative limited nature of Spanish versions of materials, not just in the Spanish language, although those are limited, but also health and culturally, appropriate. So we are finishing up our scan of that, and we're having some folks review it. And if someone wants to be a champion and also be a part of reviewing that, we'd love your help, because we really want to fill any gaps in that space that we need to. Another comment I see is understanding attitudinal and emotional drivers and barriers to vaccination so that we can leverage drivers and overcome barriers with targeted messaging via trusted communication channels. Global Vaccination Advisors is trying to facilitate this. So that's not a question so much as a comment and a resource. It's in the chat box if you all want to look at it. You know, we only have a couple more minutes left, and I know that Brandon really wants to talk to you all about our summit that's coming up. And I would encourage you also, please email or sign up, become a champion. We need you. The nation needs you. Your community needs you. I can't wait to celebrate you. So Brandon, I'm going to hand it over to you now that I've thanked our great presenters and colleagues, Kellyanne and Lash, and our wonderful participants today.
Yeah, thanks to everyone, because this was a super informative panel, and I'm just looking at it's kind of reviewing the chat box, and we had a very engaged audience. So I really appreciate that. I noticed that one thing that has been repeated is convey, not convince. So I think that was a really good point. I think we, a lot of times as professionals, we always try to you have to do this, you have to do this, but just educating folks, letting them make their own decisions is super important too. They have more ownership that way. So I really appreciate that comment. Kellyanne, I loved all I was more informed. I thought everybody was going to be a Instagrammer versus Facebook or a Twitter or whatnot, but just learning all learning how our audience likes to receive their information through social media with particular platforms, and what are the rumors that we kind of have to dispel and dismiss out there. Super important. And then finally, Laura Lee, just thanks so much for sort of taking the helm of this. She came, I came in technically after Laura Lee to join NMQF officially, and she was on this. I wasn't familiar with quality improvement and all this, the type of advocacy work that she's done, and she continues to do it at NMQF. And she is just a strong healthcare leader, and Gary somehow snagged her from various very, very influential American college of this or that, and she's just been doing such yeoman's work. And really, Laura Lee has done things like getting more people vaccinated and educating about this through champion training, or even literally directly impacting the number of lung cancer patients, lessening the number of lung cancer folks in the particular region, the Appalachian region that she worked in. So just thank you, and thank you all for your work, what you have done. I made sure to emphasize just a bit of the work that the folks on the call have done, because we will have them next Friday, I believe in 4 weeks for our
Unbelievable.
Yeah, it's just kind of coming up quickly on our national annual summit. It's our 19th summit. We started this in 2003, and in counting years, this is our 19th one, and we've got to work with all of you that are on the call, and we just hope that you can join us again in this April 26th, 27th, and 28th. We look to sort of keep educating, and I always say for NMQF, we more or less educate the educator. So we want to make sure that we provide good information for you that you can then share with others, and then participate with us. Because I love that, I know that Keiko, myself, and Laura Lee are just kind of going for these comments and say, oh, that's a great idea. Let's follow and let's do that. If you can, and if we've conveyed it to you, make sure that you go ahead and get vaccinated. Because one thing I want to do more than anything, my birthday is coming up pretty soon, and my birthday wish is that we can all meet together specifically for the summit next year. And so with that, everyone have a, I don't know what technically the holidays are, but for this upcoming weekend, in DC, enjoy your sunny yet cold Friday afternoon, and just have a good day, folks. Thanks again. Bye.